Introducing the all-new Corolla.
There was a good turnout at the second public hearing for the medical marijuana bill known as the Joaquin Concepcion Compassionate Cannabis Use Act of 2013. Department of Public Health and Social Services Director James Gillen testified, saying that this is a subject that Guam needs to begin talking about and considering, but he could not support the bill in its current form.
And I want to state my support for any reasonable consideration of alternatives to alleviate pain and suffering for those for whom conventional means have failed. However, I cannot support this bill as it's written. Quite simply, Mr. Chairman, the administrative and regulatory burden created by this bill is impossible to achieve without adequate funding.
Gillen's concern is that there has been no funding identified to address the personnel and administrative costs of regulating medical marijuana. The bill does allow public health to charge fees for administering medical marijuana identification cards, but Gillen's not sure if these fees would be adequate to cover the costs. Gillen says that in Arizona, for example, they charge a $175 annual fee for the card, and there are 40,000 people on the registry, giving them a $7 million budget to regulate medical marijuana. However, with 21 states and the District of Columbia approving medical marijuana, and a recent Gallup poll that shows that 58% of Americans approve, Gillen believes that medical marijuana will eventually become legalized throughout the U.S.
It's not a question of if, it's a question of when. And how, it's just a matter of how we're going to really do this the right way. So the Department of Justice already has had a stance to, in a sense, decriminalize people who have medical marijuana.
Gillen noted that a 2009 memo from the U.S. Department of Justice encourages federal prosecutors not to prosecute people who distribute marijuana for medical purposes in accordance with state laws. In other words, although marijuana is still illegal according to federal law, the feds have been leaving it up to the states to decide. Gillen says he's opposed to the bill, mostly because of the difficulty it poses from a regulatory perspective.
We had a long conversation with the governor. He gave us an hour of his time on this, and he's very, very compassionate. He understands that this is something that needs to be dealt with, those people in pain who can't get any other relief. But he's very concerned about, again, the regulatory aspects and how we're going to do it.
Senator Tina Muñoz Barnes plans on substituting the measure based on some of the testimony provided by Gillen.
And that is one of the major things that the committee will definitely look at, is finding that funding source to say that if this bill is going to get facilitated and passed through and passed into law, that there will be the manpower and the funding source for this to get done properly, right and properly. So,
Senator Barnes says they will also take a close look at what has and hasn't worked in the various states that have legalized marijuana to ensure that Guam learns from their mistakes and successes.
But I was